Welcome to the Village Talks podcast. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or one-size-fits-all answers. We're your hosts. I'm Dr. Jamie.
And I'm Dr. Brittany. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation. Hello and welcome to another episode of the Village Talks podcast. I'm Dr. Jamie, here with Dr. Brittany.
Hello.
And today we are going to continue our deep dive series. Today's topic we will be covering is shortness of breath in pregnancy, which I think for a lot of people feels very scary and stressful, but is thankfully more often than not something that is scary, and often has an underlying mechanical, musculoskeletal, physiological cause, not actually related to your heart or your lungs. So we're going to kind of cover this topic in depth today. Red flags, what we see, what we check, what we can do about it, and some tips and tricks for what you can do at home if you are experiencing shortness of breath in pregnancy.
Yeah, definitely. And like always with this stuff, if you are experiencing shortness of breath, please get checked out by your care provider, whether that's your midwife or your OB or another provider, because we do want to rule out big and scary first, because it is something, especially in pregnancy, if you've never experienced it before, it can be matched with like heart palpitations too. And so looking at all of those signs first as like, let's rule out the big and scary. So these conversations are, once that's done and the big and scary has been ruled out, let's move into other things that it could be a potential cause, and things that we can do about it.
Yeah. And so shortness of breath is something that can feel big and scary outside of pregnancy. I think things that people worry about are blood clots. We worry about heart issues. We can worry about skyrocketing blood pressure and preeclampsia. So, as always, if this is accompanied by sudden and severe swelling, sudden weakness or loss of sensation in any part of your body, but especially your arms, sudden onset headache with nausea, vomiting, vision changes, any chest pressure or pain. And shortness of breath is a little bit different than intense chest pressure. If you are resting, if you really cannot catch your breath, if you are wearing any type of wearable device and you can see that your heart rate is really high, that your oxygen saturation is going low, if your lips and fingertips are numb, please get in touch with your OB or midwife right away, or perhaps even go to urgent care or an emergency room if their office is not open, because those can indicate that there's something bigger and scarier going on here. Thankfully, that doesn't walk into our office. Instead, they often have been evaluated already or have brought it up if they're deciding that it's mild in a previous visit and have been told, so this is pretty common in pregnancy. Let's talk about why it is really common in pregnancy.
Everything is changing. The uterus needs a place to go. Baby needs a place to go. And so as you go throughout your pregnancy, we'll talk about increased blood volume and stuff like that, but just from a mechanical standpoint, everything is shifting up and out of the way to accommodate for this new space and this new change that needs to be made. And so what happens is the rib cage does start to flare a little bit, and depending on how you breathe prior to pregnancy, which a lot of people, and I can't wait for you to deep dive into this one, but a lot of people don't actually pay attention to how they breathe. And so in pregnancy, it really comes to light of like, oh, I actually don't utilize the entirety of my torso, core, abdomen, pelvic floor, diaphragm, all the things to breathe.
Yeah.
And so what can manifest as that is shortness of breath, because we actually don't have full access, or we don't know how to connect to that full axis of range of motion to be able to take a full breath and then create that change as we go throughout our pregnancy.
Exactly.
So that's one for sure. Yeah.
Yeah. I mean, this area is dynamic. It is changing, and there are things that can impact or interfere with those dynamics. And so we're not going to go through all the detailed stuff that we've hit in other episodes about all of the changes, but in order to understand the changes necessary through the upper body, briefly, yes, baby is growing and taking up space, therefore the uterus is expanding. All of the organs within your abdominal cavity are shifting. They are shifting upwards, and where we have dynamic movement and we have the capability of change is the diaphragm and the pelvic floor.
Yep.
And so the diaphragm is the top of your abdominal cavity. It is the bottom of your thoracic cavity, your rib cage, where we also have capacity for shape change. Not in the same way, because there is a bony cage, your rib cage, that surrounds this. Yeah. So it's not the same as the expansion we see in the belly, for example. But as you mentioned, the bottom of the rib cage should and needs to flare slightly in order to accommodate the changes that are happening there. If that's not happening, we have restriction. If we are a belly breather, which we do see, I would say the majority of, if they don't completely belly breathe, they are at least 50% belly breathing. So if you do rely on the shape change occurring in the abdominal cavity when you breathe in, because as the air comes in, it's directing the shape change, the pressure downward, then the diaphragm has to move down for that. Well, when the diaphragm hits a wall of organ or baby, where's your breath going to go? It should be able to move front to back. It should be able to move side to side. We should have a little bit of elevation here. If any one of those or multiple of those are restricted, or you don't have the ability to actively breathe into those areas, now we feel like we can't breathe.
Absolutely.
So your lips aren't blue, your oxygen saturation is good, but we constantly feel like we just can't catch our breath. Maybe it is or isn't increased with activity. It's not always. Maybe it is or isn't increased in a certain position. People will talk about, well, when I'm like, compression. But a lot of times it is this just like, I don't know. I just feel like I can't take a deep breath. I just feel like I can't catch my breath. Then we really have to kind of look at, all right, what are the mechanics of your rib cage, and let's look at restrictions in all the spaces that the air really should be able to go.
And even people who they live here. Right? Okay, well, we can't expand anymore. We can't get any higher here. So that's also where they're like, well, like, I feel like I'm constantly here. And part of it may be anxiety. We'll touch on that. But the other half of it too, right, is like, that range of motion, we always talk about it, is so important, because if you're stuck up here, it's that rubber band that's already expanded. There's nowhere else for it to go. And so it just is this constantly, right? And it's that like, oh man, I can't actually take a full deep breath because I can't really open up and expand into this cavity in this space here.
So we've got the rib cage, and when we look at breath, we look at air coming in, we have capacity for expansion, yes, up and down. So diaphragm drops, and there can be some elevation that occurs in this direction. We're also going to expand from front to back. That is lift of the sternum, lift of the anterior front ribs. We also have the thoracic spine, flexion, extension, all the musculature, your scapulas, everything back there is impacting it. And then what I find is typically not necessarily restricted, but where people often are not breathing is laterally into the ribs. And then especially pregnancy, you go and now you're side sleeping, there's no downward expansion on that side. And so there can also be accompanying sensation of pain, restriction, or tension in any of these tissues too. Not always. Sometimes people are saying, I have shortness of breath. No, everything feels great. more often than not, they're also saying, and my upper back feels tight, or and my shoulders feel high, or my ribs are sensitive on the front, on the side, on the back. They will often tell us exactly where the restriction is. Yeah. And once we can kind of tackle that, whether it's releasing it through an adjustment or just helping them perhaps for the first time breathe and expand into an area where they have the capacity, I would say 2/3 of the time, 3/4 of the time, they actually can expand there with a little bit of direction and guidance. The other 25 to 30%, there is a true restriction there, and we've got to kind of work through that so that they can then breathe into that space.
Absolutely.
I think though, those are kind of some of the mechanical things, and we can touch on how we treat them. But I do think, as you said, another factor for a lot of people here is anxiety.
Yeah.
And shortness of breath, feeling like your heart is racing, feeling like you can't breathe. You are truly physically experiencing these in your body, but sometimes it is created by the brain itself versus an actual mechanical restriction. So this is where, like, we've ruled out big and scary. We've potentially ruled out that some of this is a musculoskeletal restriction. Yeah. Now we got to kind of look at, all right, what else is going on, right? How are we feeling about things? What are we thinking about things? When are we feeling this, right? Is it when we're driving? Is our stress commuting us out? Or is our commute stressing us out? Is this when we're in a provider's office? Is this when we're thinking about birth? Like, let's kind of try to explore what is the trigger for that anxiety, and then this body sign that we're experiencing.
My favorite one is, do you have a high stress job? Because if we can make it work, I am a big fan of getting on leave early. Yeah. Especially if we have a high stress job. Yeah. Because that is going to impact just our overall function, how we feel in our body, how we feel about our pregnancy, how we feel about upcoming birth and postpartum and things like that. But having a really high stress job, we've touched on this before in other episodes, but in order to help yourself regulate, a lot of times in pregnancy, we don't have access to those things anymore. Like running, people run in their pregnancy all the time. That's not what I'm saying, but it's not the same effect and the same level that they are used to doing beforehand. And movement and activity is really something that helps them calm. But if they are having this shortness of breath and they're getting it with their movement and stuff like that too, that's something that we need to address as well. And what means do we have to help ourselves find calm? And it's not just like, I'm peace and calm all the time. We're going to experience different waves of emotions, absolutely. But what tools and resources do we have to be able to address those so we can come back to center?
Yeah. What are we actively doing to reduce stress? And I had this conversation with somebody recently, actually outside of the practice. I'm like, I don't really feel stressed out. And I'm like, that's great. Yeah. Your body says otherwise, right? So stress can manifest in a lot of different ways, and it's not always that mental load of, I feel stressed out up here. Yeah. What you're feeling here is stress. Yeah. So stress management is huge. Yeah. I think when we, in particular, with the nature of our practice, our geographic location, when we look at the age of a lot of our clientele, we do have people who have high demand, high stress jobs, and they are often in positions of power. They are highly educated. They've worked very hard to get to where they are in their job. Yeah. And, we have touched on maternal identity in other episodes, and without diving too far down that rabbit hole today, there is a lot of internal struggle around stepping away from that for any period of time. Am I going to be able to step back in? Are you perhaps not performing at your job in the same capacity because you have a little bit of mommy brain going on? Yeah. You have increased fatigue. Your concentration is broken by things like pain or shortness of breath. Yeah. Or worry about a test result or birth or whatever. I think how well we do our job is impacted in pregnancy, and it's not lack of trying. Yep. It's not lack of intelligence. It's not lack of effort. It's just part of change. And then I do think there's a lot of stress about, well, this project, my team, and what happens when I step away.
Yep.
A lot of people are stressed out about, I have to get these things done before I go on leave.
Yep.
I have to train my replacement before I go on leave. There's often a work deadline that precedes your due date. And so we can't always control that stress, but we have to find ways to manage how it is manifesting in our bodies.
Yep.
We do encourage people to try to take leave, period, before your baby gets here, right? Because people are like, I'm going to work until this baby gets here. Okay, great. What if you put in notice after your due date? Like, you have to give yourself permission that at some point it's okay for me to put this aside and step into this.
Yep.
Even if it's a date that you know you're probably not going to actually work until.
Yeah.
That mental process is super important.
Absolutely.
And it's okay to acknowledge, even if it's just within your own head, that how you're working isn't the same. And acknowledge the fears, because that alone, best case is you are talking to somebody about this, whether it's a therapist, whether it's a partner, whether it's a vent with a provider.
Yeah.
You know, we're not here to give expert mental health advice, but we're definitely, we can listen.
Yeah.
Sometimes that's all it takes to reduce the anxiety and reduce that mental load, which is then going to create a shift within the physical manifestation for that stress.
Absolutely.
And we do see so much pregnancy anxiety.
Yeah. Like a good amount too.
Yeah.
I also think too, geographically where you're located, we are above sea level. We have altitude. So our oxygen is a little bit less here, thinner here. So something that has been interesting coming from California to Colorado is the amount of shortness of breath that we do see in our clients, because just by nature of where we're living, there's not a lot up here.
I mean, best case O2 saturation is about 95%.
Yeah.
Like, that's pretty average here.
Yeah.
We also have a lot of people who have moved here, sometimes somewhat recently.
Yep.
So that's always one of my questions too. How long have you been here? How long were you here before you got pregnant? Like, did your body actually have an opportunity to acclimate to this new altitude before we start adding in additional challenges?
Yep.
So, you know, sometimes there are physiological reasons that they're feeling shortness of breath that are not big and scary.
Yep.
But if we can also bring in creating more capacity here through a mechanical
way or means.
Then it can slightly reduce that sensation.
Definitely.
Because I mean, we've been here for a long time, but I remember moving here and being so excited. There was a small lake across the street from our apartment complex. And I was like, great, I have been running around the neighborhood in Chicago. Now I'm going to run around the lake across the street, and was like, oh my God, I'm dying.
Yeah.
Like, I consider myself to be in good shape. I've been running. I've never been a super long distance runner, but I mean, I could run 3 miles and be totally fine. And mile 1, I'm like, what is happening here? So like, you can be in great shape before you get here. It is just different. And it has nothing to do with, you know, lack with you or your body.
I get winded going up our stairs. I'm like, wait a minute, hold on.
So I do think we see it a lot more perhaps than the average practice. But, you know, in the body, yes, we want to address all of those things. Do we have flexion and extension? Do we have 3-dimensional breath? Is the rib cage capable of expansion in its full dynamic capacity? Do we have any restrictions in the ribs? Either, you know, most of the ribs in the back each have 2 joints with the thoracic spine. So if the thoracic spine isn't moving, or any one of those rib joints isn't moving, now we have a restriction. The capacity is limited. Maybe it's limited 2%. Maybe it's limited 30%. Right? Those are the things that we're looking for. There's so many muscles. We've got the intercostal muscles. We've got all of the muscles around the scapula, the side of the body. There's a lot of potential for restriction. So posture is a big one. Sleeping posture, seated posture, I think is, because I feel like that's what I hear the most, is where they feel most restricted is often when I'm driving my car, when I'm sitting at my desk, anybody who works with their hands in front of them. I feel like that's where I'll hear it the most.
Yeah.
But sleeping posture, we spend hours in this position. What that looks like is going to have an impact on your ability to feel like you can breathe in that seated posture all day too.
Yeah, absolutely. Yep. Go ahead.
I think I don't hear as much of it as an active restriction with exercise.
Yeah.
So it's not to say that that doesn't happen, but I feel like what we mostly see is this feels a little bit more passive.
Yeah.
Where they're like, I'm not even doing anything, but I just feel like I can't take a deep breath.
Yep.
Yeah.
Yeah. And that can be scary when you can't catch your breath, and then that leads to stress and anxiety. So finding ways that, whether it's a PT, whether it's a chiropractor, whether it's acupuncture, something like that to help with your stress, but then also to look at the biomechanics and see how your body's adapting to pregnancy or not is super important. And one of those things, we say it all the time here on our podcast, is don't wait. Yeah. Don't wait for it to get worse. Obviously, we rule out big and scary, but we also want to make sure that you actually thrive throughout your pregnancy instead of just survive, because that has a very different emotional blueprint for both you and baby as well, going into this new chapter of your life. Having shortness of breath is hard, right? Like we also get pregnancy rhinitis too. And so if you have shortness of breath because your rib cage isn't moving and now your sinuses are also swollen, that's also very scary and stressful too. So making sure that you address all of the factors that go into how your biomechanics are working. And it's not the we're going to optimize your health. It's, I want to make sure that you're functioning well. Yeah. So you can actually have fun throughout your pregnancy and not wake up miserable. Yeah. Yeah.
Yeah. So if you're not experiencing shortness of breath, if you don't notice any tension or restriction or pain in your upper body, great.
Yeah, great.
But so many people do. And we want them to understand that, yes, great, we ruled out big and scary, but you don't have to deal with it. It's common, but not necessarily normal. And the wait and see approach, it's probably not going to resolve or improve during the course of a pregnancy because you're going to get more pregnant.
Yep.
Your baby is going to occupy more real estate in the abdominal cavity, which is only going to further restrict diaphragmatic movement and require more of this expansion coming from the rib cage and the upper body. So we kind of touched on some of the mechanical causes, some of the things that we're checking. Aside from adjusting spine and ribs, what are some other things that people should be hoping for or looking for? What are we doing in the office to try to create some space here for them?
One thing they can do just at home assessment, things like that, movement.
Yeah.
See where you're restricted. Move your body in rotation. We talk about this all the time, but rotate your body, see where you're restricted, add in extension and flexion and lateral bending, and notice where you feel tension. That's a great home assessment that you can do just in general, but we do that in the office as well. We assess cat-cow to see, are they actually able to flex and extend throughout the entirety of the system? How is the rib cage working? We assess their breathing in all 360 container. We check, are they belly breathing? Are they chest breathers? Can they do a full breath? Do they know how to connect to their breath? That's a big one. Go ahead.
No, say that awareness, right? That 360 assessment, I think, is one of the biggest game changers we see for people.
Absolutely.
One, they actually feel their rib cage expand. And there is something that clicks with them. I think from the anxiety standpoint, it helps to be okay, I feel that expansion. I can breathe. I am pulling oxygen into my lungs. That can immediately reduce a little bit of the anxiety they have around, I feel like I can't breathe. It also raises that conscious awareness, which I think is what they need. In order to keep breathing into this space, you've got to realize that is a little bit of a blind spot for you. And so we are going to open your eyes, we're going to turn on the lights, and now we are going to practice this continuously because anytime you feel like you can't breathe, here's what you're going to do. It gives them a very specific tool lowers their anxiety immediately, also increases oxygen saturation.
Yep.
Now we're gonna, create more space in this area so that you can continuously breathe. You continuously have access to this space.
Yeah.
Which is going to kind of reduce some of the symptoms they're reporting more consistently.
Absolutely.
Yeah.
What functional like assessments and stuff are you doing too that you give, or maybe like things that you give them at home?
Yeah, I would say, I think, we're doing the same assessments at this point pretty much.
Yeah.
But it's kind of all the stuff you just talked about. One of my favorite things to have them do at home, because it's multifunctional, is just lifting your arms when you inhale, right? Mm-hmm. So I'm like, even if you hold your breath and don't actually breathe in and lift your arms, you will feel your body pull in air.
Yeah.
Right? So when you inhale, big deep breath in and lift your arms up, oh my gosh, you're literally opening the lower part of the rib cage. You're creating space in between your ribs. You're creating lengthening in your intercostal muscles. Now we've got all the side body. We've got under the scapulas. Like, that is one of the easiest things to do. So when we look at any movement with the upper body, you have to couple your breath. We're talking about shortness of breath, and we're talking about how do we mechanically reduce this sensation. You have to think about how you're breathing when you're moving. It's always important, but I feel like with this particular issue, it is the most important.
Absolutely.
Once we get there, I think there is a lot of talk throughout pregnancy that discourages rotation, right? And discourages anything where we think we're going to create length or stress or strain or stretch on the abdominal musculature. And I'm like, we're not doing deep twists, but rotation is still safe.
Yeah.
And so expansion, and then very light controlled rotation that is through the rib cage, not relying on the rotation through the lower part of your torso and into your hips.
Totally.
Your upper body and your rib cage should be able to rotate to some degree without involving the bottom half of the body.
Yeah.
One of the things I was going to say is this is almost certainly going to be different from right to left.
Yeah.
And so, when you're going through movements and you're going through stretches, paying attention to, because when we do rib cage assessments, the rib cage usually is not symmetrical side to side. It doesn't sit in the same position from left to right. The expansion is different from left to right. That can absolutely be normal to a certain degree, depending on your job, depending on injury, depending on your patterns and your hand dominance. Okay, everything doesn't have to be perfectly symmetrical.
Totally.
But as we lose that symmetry and we start to see greater restriction on one side or the other, how is your body accommodating for that, right?
Yeah.
What are the ways that your body is trying to, sometimes the pain is not where the restriction is. The pain is where we're overexpanding. Because we have a restriction elsewhere.
The compensation,
So as you go through stretches and movements and things like that, also paying attention to where do we feel stretch? Where do we feel restriction? Where do we feel, is it restriction with pain?
Yeah.
Right? Is it, I actually can't go as far this way? Do we want to lean into that and try to go further? If it's not painful, sure. If it is painful, no, that may already be where you deep stretch and we don't need to go any deeper there.
Yeah. One thing too, when people think about posture, right, is we're taught, shoulders down and back, and you line up your ear to your shoulder and all that kind of stuff. And so what I notice is when people do this type of posture, they actually compress the backside of the rib cage. And so they're coming here instead of here and lifted too. Yeah. And so
sit up straight for most people means thrust forward.
Yep, exactly. Yep.
Lengthen the front, compress the back.
Yep. Yeah. And that's what I see a lot of in pregnancy too, because as everything's coming forward on the front side of the body too, we open and then we say, okay, well now I have to sit up straight and stand up straight too. And so now the whole backside of the body is completely compressed. And one practice that I really love, and you've heard me talk about a lot, is bowspring. Bowspring is great. Desi Springer and John Friend, they are really, I think, changing the game when it comes to feeling your body
Yeah.
and understanding what it's like to be open. And it's a really easy, gentle practice that you can do every single day.
Yeah.
And it's not an hour-long workout class, because if we have work, if we have toddlers, if we're having all these other schedules, sometimes it can be hard to get to an hour or two workout class. And that hour or two workout class is 3 hours of childcare potentially, right?
Yeah.
And so it's an online thing that you can do at home. That's something that I always tell people, like, if we're having a hard time breathing into our rib cage and really opening up into our body, like, I immediately send them to post spray.
Yeah. Mm-hmm. Yeah. And it's, we've talked about this before too. It's there isn't one right or wrong way to breathe.
Yep.
The best way to breathe depends on what are we doing?
Mm-hmm.
What is our activity? What is our goal?
Yep.
And a lot of us have created some breathing habits that supported something at some point, but oftentimes don't support the changes that we experience in pregnancy.
Yeah.
And so it can feel a little bit overwhelming to think about something as big as changing the way that I breathe. Mm-hmm. You don't have to change the way that you breathe all the time.
Yeah.
We just want to make sure that you don't have limitations, that you can breathe fully into every dynamic space that you should be able to breathe into, and that you have the ability in these moments of shortness of breath, or in the times where we are feeling tension or restriction, to be able to consciously and intentionally, even if it's only for 5 or 10 breaths, do that. Right? We are not teaching you how to breathe 12 to 15 times a minute, 60 minutes, an hour, 24 hours a day. No, you this is autonomic. You're going to breathe whether you think about it or not. But when we can breathe a certain way on purpose at certain times, you're increasing capacity, right? You are creating space, and you're increasing the likelihood that when you shift back into that unconscious autonomic breathing, you're going to continue to do so into the space that has been created.
Absolutely. And why we're so passionate, I will say, about breathing is because when you're in labor, your breath is the most sacred and important, best tool that you can utilize in labor.
It sets the tone and foundation for everything.
Literally everything. So it's not just we want you to feel comfortable in your pregnancy. Yes, of course, we want you to enjoy your pregnancy. And we want you to be able to have full access to this when you're in labor, because it's going to change and shift dramatically throughout your labor. And if you are having shortness of breath, and you add in the intensity of your contractions and just birth in general, that can be very overwhelming for a lot of people. And so what ends up happening is when we're in that shortness of breath too, we do end up getting into more of that fear-based fight or flight nervous system, because we're breathing shorter, all the blood flow goes to our extremities, we kind of get into this panic state and this fear state, and then on a physiological level, that's going to impact the direction of your birth as well. Not that I'm saying if we have this stuff, you're going to have terrible birth.
No.
But I want you to be able to understand how to regulate that in the birth setting. It's so, so important.
Yeah, that it has value beyond resolving your shortness of breath now or making you more mobile in your rib cage. I think this is one where it doesn't quite get enough attention, or once big and scary has been ruled out, it does sometimes sort of get dismissed and people are like, I just have to deal with it. And I think we want people to know that, even in the absence of pain, this is still something that's important for a bigger reason beyond this discomfort that you're experiencing.
Absolutely.
Anything else that you can think of?
No,
I think again, just, if you are having this issue and you're local, please come see us. We would love to help. If, you have somebody in your community that specializes in pregnancy and body assessment and awareness, that's a good start. And if you don't, then there are online resources and online tools. And I think I do recommend that we are seeking out videos and types of things that are specific to pregnancy, because we do want to take into consideration things like deep twisting and understanding that there are some restrictions, that we have the potential for more movement through relaxin. So how we move and how we stretch needs to take that into consideration.
Absolutely.
But yeah, upper body stuff, different types of breath practices, your own self-assessment of where do we expand into and where do we not expand into. I think those are also really valuable.
Yeah.
And something to try. Potentially, even before seeking us out.
Yeah, absolutely. Yeah. We're big advocates. Hopefully you guys know this by now, of doing home care and things at home, because we don't want you to just rely only on your providers. We want you to have your autonomy. We want you to be able to have these thoughts and conversations of like, okay, what are the things that I can try? All right, I've done all of these things. Now I need to reel in some other help, right?
Yeah.
Like, we're big advocates for that. And we always give homework out because we don't want you solely relying on us for everything.
And it's always like, help me help you.
Exactly.
Right? Like we can do things hands-on to help create change within your body in our office. And we love doing that. Yeah. But we also want you to be able to go home and actively do things to maintain, sustain, improve and build upon the work that we've started.
And feel like you're an active participant in it too, right? Because sometimes body work is passive.
Yeah.
You come in, we get adjusted, we have a conversation, all the things, yes, but sometimes it can feel very passive. And so we give homework for a reason because we want you to be an active participant in this.
Absolutely. Hopefully this helps to shed some light on some of the common causes and some of the things that can be utilized to help with shortness of breath in pregnancy. As always, if you have any questions or comments, drop them below. If you experience this in your pregnancy or you found something to be particularly helpful, those comments are helpful for other listeners. We are always happy to read comments and help people in any way that we can. Yep. So you can come and see us at Belly Bliss here in Denver, or reach out to us through social media, email, any of that. Otherwise, thank you for joining us today, and we'll see you again soon.
If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.